Most women don't realize that when testing their hormones, that needs to be done at specific times in their menstrual cycle. And if you've gotten your hormones tested and you've been told that they're normal, but you're still feeling off, then it might be because you've been testing your hormones at the wrong time. In this video, I break down when to test progesterone, and hint, it's not just any day in your cycle. I also go through when the best time to get your estrogen, LH, and FSH tested. And I also go through one of the biggest mistakes that women make when getting their hormones tested. Check it out. I'm Mariah, and I help women take control of their PCOS and insulin resistance. With over 8 years of university education and a naturopathic medical degree, I've guided hundreds of women to take control of their health. And if you want more practical tips, make sure you hit that subscribe button. So if you're getting your blood work done to check out your hormones, make sure you're not making these very common mistakes. A lot of women don't realize that timing is everything when it comes to looking at your hormones. So if you don't test at the right time in your cycle, you could be getting completely inaccurate results that really aren't that helpful. So let's break this down. As you've probably noticed, your hormones fluctuate throughout your entire cycle. And one of the main hormones that is often tested incorrectly is progesterone. Progesterone should only be tested about 7 days after ovulation. So if you have an average 28-day cycle and you ovulated on day 14, you would want to be getting your progesterone tested around day 21. And this is because progesterone begins to rise after you ovulate. And the peak of progesterone is often 7 days after you ovulate. And that is why it's best to test it at this point. And as you can see in this graph, progesterone is low the rest of the time during your cycle, and it only rises during that luteal phase. And we often test progesterone for 2 or 3 different reasons. The most common reason why we test progesterone is to confirm that ovulation did occur. And it also lets us know if you did have a positive pregnancy test, if you have adequate progesterone levels to maintain your uterine lining and to support a healthy pregnancy. During those first few weeks of pregnancy, progesterone is created and maintained by the corpus luteum. And then after that, placenta takes over the progesterone production. And if you don't have a positive pregnancy test and an egg didn't get fertilized, then that progesterone level will drop, as will some other hormones, and then that will trigger your menstrual cycle to start and for the bleed to begin. And now we will talk about estrogen. So the main estrogen that we test on blood work is estradiol. And estrogen can be tested at multiple times in a cycle because it fluctuates quite a bit. However, the most common day that we will test estrogen would be day 3 of your period. And we often test day 3 estrogen levels because this gives us your baseline estrogen. And then there are 2 other hormones that are often tested on day 3 of your period, and that is luteinizing hormone, also known as LH, and follicular stimulating hormone, which is known as FSH. FSH stimulates your ovaries to produce follicles, which are those immature eggs. And if we see high FSH levels during day 3 of your period, that can either indicate poor ovarian reserve, or it could indicate perimenopause. And then when we are looking at luteinizing hormone, so day 3 LH, we often compare LH to FSH, and we look at the ratio between the two. LH and FSH should be around the same level when we're comparing the two of them. But if we notice that LH is much higher than FSH, so double or triple the amount of what FSH is, then that can be one of the first indicators of PCOS. Now, LH might be tested on day 3 of your cycle, or it can also be tested in terms of assessing for fertility and ovulation. So oftentimes it may be tested around days 10 to 13 of your cycle. That LH spike surges right before ovulation, and it's actually one of the triggers to tell your ovary to release an egg and to ovulate. And what I often see women doing when they go to get blood work done is they go to get their hormones tested on a random day and all at the same time. But if you're looking at LH, FSH, estrogen, and progesterone, we know that progesterone should only be tested during that luteal phase, so 7 days after you ovulate. And then we know that estrogen, LH, and FSH is more commonly tested on day 3 of your period, which is in that follicular phase of your menstrual cycle. So those should be separated. Now, with that being said, you can test estrogen, as I mentioned before, at multiple times in your cycle. So you could test day 3, you could test around ovulation, and you could also test with progesterone. So we can see how the estrogen is rising and falling. That's totally fine, but just always keep in mind, progesterone should always be in that luteal phase. And this is why it's very important to track your menstrual cycle so you know when to get the hormones tested. You need to understand when you ovulate, so we know when to test for progesterone. And you should have some idea for when your period's going to come, so you can estimate when day 3 will be, so you can get that LH, FSH, and estrogen tested. So now you know how to test your hormones the right way. So please don't let incorrect testing end up confusing you about your health. If you found this video helpful, please subscribe so I know to make more content like this for you. And if you have any questions, feel free to drop them in the comments below.